Hi everyone, this is Professor Williamson and this is a audio to accompany the PowerPoint presentation that is reviewing the assigned non-graded Appendix C cases that relate to the area of pregnancy coding. So in the back of your course textbook, there is an Appendix C that has longer, what I would typically call case studies, and this presentation will focus in on those particular ones that you were asked to do, which was 1, 2, 3, and 5 in that section of your textbook. This gives you an opportunity to review the coding process and how we apply the coding guidelines, the ICD-10-CM guidelines in this case, and the UHDDS information if the patient is an inpatient when we're looking at clinical documentation. So the first one is a patient who is pregnant at 38 weeks gestation. She is had in the past a cesarean section noted in the clinical documentation as a low transverse. She also is coming in for that procedure to be repeated, and she also is asking for a tubal ligation. The outcome of her delivery is a 3,300 gram male infant who has really good APGAR scores of 9 and 10. So that denotes that he is a live infant. And on day 3, the mother and the baby were discharged. Discharge diagnosis per your clinical documentation is term pregnancy delivered elective tubal ligation. So what was the reason for admission? This woman was being admitted to have her child. However, based on what we learned back in the pregnancy chapter, she did not have a vaginal delivery. Therefore, she could not be assigned the normal delivery code, which is the 080 code, because she had a repeat C-section. And the reason why she's having a C-section today is because she had a C-section in the past. And we know what type of C-section it was because it was a low transverse. So we're going to index the main term of delivery, and then previous, then low transverse, scar, and we receive the code of 034.211 in the alpha. We review the tab index for any notes, exclusions, inclusion notes, and we assign 034.211 as our principal diagnosis. We also know, based on our information back in the pregnancy chapter of this textbook in this class, that we also have to assign a code for the outcome of delivery, which was a single live birth. In this case, it was a male. The code for that is Z37.0. We also need to assign a code for her elective tubal ligation that was done immediately after the delivery. The code for that is Z30.2. And we also, because the child was born alive, there was an outcome of delivery, we have to assign a code for gestational weeks, and her weeks are documented as 38 weeks. Z3A.38 is the code for that. So we have 4 codes on the ICD-10-CM diagnosis side assigned, with 034.211 being our principal diagnosis code. And as per our procedure in this class, we are not coding PCS. This woman also has an episode 2 in your clinical documentation. So 7 days after she has her C-section, she returns to the ED with 101 temperature. The clinical documentation is a discharge diagnosis of a post-operative wound infection. So she has a wound infection of where she had her C-section. Where the surgeon cut into her, that area has now become infected. That would be our primary diagnosis code because this is outpatient. She was discharged from the ED. Oh no, it looks like she was admitted through the emergency department, so she wasn't inpatient. So it would be our principal diagnosis code. It says she was admitted through the emergency department with a temperature of 101. So she was admitted. So it is a principal diagnosis code. When we talk about the code, it's a principal diagnosis code. We're going to index the main term of infection, then obstetrical surgical wound, and we get the code of 086.0. We review the tab index. It's just part of our coding process to make sure we don't need any additional character values or digits, and we don't have any inclusion or exclusion notes or no code also notes. And we find we don't, so we assign the code of 086.0 for episode 2, case 1 in Appendix C. The next one you were asked to do was case 2. This patient is a type 1 diabetic who is on insulin, who had a C-section 12 days prior. The day before admission, she noticed a large amount of bloody discharge from her cesarean wound. She was admitted and taken to the OR, where the wound was opened and a very large hematoma was evacuated from the abdominal subcutaneous tissue. The wound was drained and packed, and 3 days later, they did a secondary wound closure. The secondary wound closure would be coded on the PCS side. We're coding just the diagnostic component. Her discharge diagnosis, as per your documentation in the textbook, is postpartum hemorrhage, diabetes mellitus. So what was her reason for admission? What was her principal diagnosis per UHDDS guidelines? She's coming in because she has this bleeding, which is determined to be a hematoma within her obstetrical wound, or obstetrical surgical wound. So that is what we're going to code as our principal diagnosis. The main term is going to be hematoma. Subterm would be obstetrical surgical wound. We arrive at the code of 090.2. We check our code in the index. We also want to assign code for her diabetes, because obviously she has a higher rate of having post-op complications, having diabetes in general. And she's a type 1 diabetic. So her diabetes is not gestational. There's nothing about gestational identified in our clinical information. She had diabetes before she got pregnant. She has diabetes now. So we're going to index the main term of postpartum because we're identifying that she has diabetes now in her postpartum period. She's already delivered her child 12 days earlier. And we end up with the code of 024.003. And we also assign a code Z79.4 because this woman is taking insulin. So we end up with 3 codes of 090.2 is our principal diagnosis, 024.03 is our additional code, and Z79.4 is our second additional code. Case 3, you were asked to also code as a woman who was admitted in active labor. She's 39 years of age. She also is a 39 weeks gestation. She comes in and is only dilating 5 centimeters 6 hours after admission. They give her Pitocin, and she could progress to full dilation or to complete dilation. Low forceps were used due to arrested active phase of labor. So she dilated, but then her labor stopped during the delivery process, and they had to use forceps to facilitate getting the fetus or the baby to be born. They did not do an episiotomy, and she did suffer a second-degree perineal laceration. The male infant was born weighing approximately 2.835 grams, Apgar scores of 9 and 9. The patient had indicated before delivery that she desired a sterilization. Following delivery, they did a laparoscopic bilateral tubal ligation. Discharge diagnosis is identified in your clinical information as delivery at term, perineal laceration, elective sterilization. So this woman comes in. She's 39 years of age. She does have a single child, but she suffers a laceration, and she also, or the physician also has to use forceps to help facilitate getting this baby out of her body. Therefore, she cannot be assigned the normal 080 code for normal delivery. It identifies that she has arrested labor for the clinical documentation. So we're going to index the main term of delivery because she did deliver. Then we're going to go complicated by, and the terminology is uterine inertia. And that again is identified by the use of the arrested active phase of labor. In our medical coding, in our medical dictionary, uterine inertia is no effective contractions during labor. So we're going to index the word of delivery, complicated by, uterine inertia. We get 062.2. When we go, and this is one of the cases where it's important that we should always do it, but it's important that we go to the tab index. When we go to the tab index, 062 is the code category, and it has distinctions in that particular code category. And once we review those distinctions at 062, we find that the correct code is 062.1. At the 062 code category, we have, 062 code category, we have several options. We have, for the fourth digit, we have 0, 1, 2, 3, 4, 8, and 9. Reviewing all of those, one of those specifically says arrested active phase of labor, and that happens to be 062.1. That is our principal diagnosis code. We also need to assign a code for her perineal laceration. The main term is laceration, then the location, then during delivery, and then the degree of the laceration, which is second degree. We end up at 070.1. We move to the tab as always. And then of course we have to assign codes for her outcome of delivery, which is a single live born child. In this case, I believe it was a male. We also have to assign a code for her weeks of gestation, which is 39 weeks. And we also have to assign a code for her elective sterilization. We end up with 6 ICD-10-CM diagnosis code. 062.1 is her principal diagnosis. 070.1 is a secondary diagnosis. Z37.0 identifies outcome of delivery. Z30.2 is elective sterilization, and Z3A.39 is the code for weeks of gestation. Case 5 was the last case that you were asked to code, located in Appendix C. We have a woman who comes in active labor. She's 27 weeks pregnant. The fetus is in a breech presentation. This woman also has a history of recurrent pregnancy loss or recurrent miscarriages. She does end up having a live female infant delivered via C-section because of the breech presentation. So what was her reason for admission? She's at 27 weeks in active labor. And that is an early labor. So we're going to index delivery, preterm labor. We arrive at the code of 060.12 with the placeholder of X0, and this is one that is very important again that you go to the tab index, because you're not going to code the code completely if you do not go to the tab index. And remember that the lowercase x is a placeholder. This particular code requires a 7th character, which we are given those options at 060. And we have to use a placeholder character to be able to use the 7th character correctly. It has to be in the 7th position. We can't code 060.120. We have to code 60.12x0. And 0 is identified for a single gestation as per the note box given to us at the beginning of that particular code category. We also want to reflect that she has had recurrent miscarriages or recurrent loss of pregnancy. The code for that is O26.22, and before we do that, we also need to code her obstructed labor. Because this woman has a child that is in a breech presentation, the code for the obstructed labor is O64.1XX0. That's also a code that you must go to the tab because you need to identify the 7th character value, and you need 2 placeholders in this case. Then we have the O26.22 for the 3rd code for her pregnancy care because of her recurrent pregnancy loss. Then we reflect the outcome of delivery, which is Z37.0, and then the weeks of gestation, which in her case is 27 weeks, Z38.27. And again, we would code the procedure on the PCS side, which we're not doing in this class. So one of the things you should really understand, hopefully, from this process of coding these exercises is the importance of using the tab index, especially for your pregnancy codes, and the reminder of using the placeholder character of X when needed, because if it says 7th character, it has to be in the 7th character position. It can't be in the 6th character position. If you have any questions on this presentation, you can inbox me or post to the related lesson discussion area.